Good afternoon, everyone. Thank you so much for coming in today. It's a star-studded event with CPO, MLTSD, and WSIB here. We welcome all the panelists. We welcome all the attendees who were able to make it this Thursday afternoon. My name is Keshav Kuber. I basically take care of marketing at 4S, and I will be coordinating this event along with SOBE. I will be managing the slides. So if any of the panelists would like to move forward, please do let me know. Just some quick ground rules. I would like to request all panelists to please be on mute when they're not speaking. Again, when it comes to the slides, do indicate and let me know if you want to move to the next slide. This webinar is being recorded. So please note that we will be, we'll be recording and sharing this to all the attendees and participants later. All the attendees can ask questions using the Q&A box at the bottom of the Zoom screen. This is so that you can interact with the panelists. And please keep your questions related to the webinar. If we will have some time allocated during the webinar. If you're not able to get to your questions during the webinar, we will reach out to you after the webinar is done. Having said that, we move on to the next slide. So we will just spend 30 seconds to about a minute to answer 5 questions. We will have an online poll. This poll is basically designed so that we can understand who our audience is. And also it will give our panelists, time to pivot their discussion accordingly. So if you could just see your screen, we will be launching the poll right now. So please go ahead and answer these 5 questions. SOBE, if you want to take over the questions.
Thank you so much, Keshav, and thank you everybody for joining us today. It is a great pleasure to have our panelists, and their time is really valuable. We do want to take the first couple of minutes to do the poll because the poll will give us a good understanding of the audience, and we do want to share the results of the poll with the CPO's office and WSIB so that we all kind of understand where the audience are and what kind of support is really needed. So please do take the time to quickly go through. It's only 5 easy questions, yes or no. And then we will actually publish the poll results right away. So please take a moment to quickly go through the 5 questions. Thank you so much.
So we have about 65% of the people who have given their opinions to the poll. We will just wait a little bit more longer until we get a few more results in.
I would really appreciate all of you can take the time to just quickly do the poll. The poll will really give us indication of where everybody's knowledge is when it comes to health and safety. So we really, really appreciate you taking the time to do the poll, please.
Okay, so in about 10 seconds, we will be ending the poll. So please, if you have a chance, please do answer the questions and we will be publishing the answers shortly. Okay, so I think we have enough responses from our attendees. We will be ending the poll now. And so here are the results. Okay, I think there's some issue with the audio. So I will go through the question. So I think the first question was do you understand Chief Prevention Officer's responsibilities in Ontario? So 56% of the people have said yes. So majority of the people do know what the CPO's responsibilities are. So I think Mr. Moody can throw some light on this in his section. So that's 56% of the people that understand the responsibility of CPO in Ontario. The second question is, do you know that if you have more than 5 employees, you're required to have a safety rep identified for your location or site? A resounding majority of 96% of the people said yes, they do know that they need to have a safety rep identified for their location. Which is great. The third question was, do you provide any additional OHS training for your supervisors and managers? So 84% of the participants have said yes, they do provide additional, which is fantastic. The fourth question was, are you aware of the rebate programs from WSIB and Ontario's SOSE program? 64% have said yes. So that gives us a very good indication that we have the right audience in the webinar today. The last question was, are you enrolled in any of the rebate programs from WSIB and SOSE? 20% have said that they have enrolled in WSIB. 4% have said that they've enrolled in the SOSE program. 7% have enrolled in both, and 69% have enrolled in none of the programs. So that gives us a good indication of who our audiences are, and I'm sure the panelists will appreciate the mix that we have today. So I'm going to stop sharing the poll, and we move on to the next slide. So we have, Sobi, are you there?
I'm here. Can you see me and hear me?
We can hear you, but I think your video is a little.
I can see you.
Okay, perfect. So I'll take over from here. Thank you so much, Keshav.
No problem.
I do want to personally welcome Dr. Joel Modi. He will be our first presenter today. His time is very, very valuable, and he definitely makes himself available for as many meetings to stakeholders to get the message across. So we really appreciate having him here today. Kate Cowan is the Director of Training and Awareness. Unfortunately, Kate couldn't make it today, but her team members, Richard and Annie, are joining us today. And it is a great pleasure to have Rodney Cook with us, VP from WSIB, to take us through the incentive programs. And Rodney has always made himself available to get the message across about the rebates program. Thank you so much for your valuable time today. And it is going to be a great session. As I mentioned, we had 185 people signed up as of today for the seminar. Right now, I believe we have just over 111 logged in. So it is good to have all the people who can make it, because this is going to be a great session where you get to learn about the CPO's initiatives as well as WSIB's incentive programs. That being said, so thank you for the panelists, and we had some great partners who are there to support us. They actually worked with us to get the message across to all the various different industries. So starting with OGCA, who's always been a great support and a great partner for us in the construction industry, along with Barrie Construction Association. We have quite a bit of municipalities who have joined us to learn more about what's happening. And AMO for us is one of their preferred vendors, exclusive partner when it comes to health and safety. And it is a great pleasure to get AMO's support, and all the municipalities who have joined us, we really, really appreciate it. And from the service sector, especially with everything opening up, we have the Greater Toronto Hotels Association and ALMA, who's supporting us. Again, we are their health and safety partners. There's quite a number of hotels that have joined us today to learn more about the various different programs that Ontario is offering. That being said, I'll start off with a very quick intro about who we are and what we do for those people who don't know about 4S. My name is SOSE Nathan. I'm one of the senior partners, VP of Operations, Strategies, and Partnerships. And I get the pleasure of doing many of these sessions with stakeholders, CPO's office, WSIB, and all the various different industries. So just to give a quick snapshot of who 4S is, 4S focuses on building the health and safety ecosystem. That being said, we have three major pillars: consulting, training, and system. It's an integrated approach that we offer to our clients. And our main focus, our mission is to embrace workplace health and safety culture and offer sustainable health and safety solutions to our client. It is a long-term relationship. It is a long-term journey, but our end goal is sustainable safety culture for workplaces to make Ontario workplaces safer. When we talk about consulting, we do get involved in gap analysis, full COR audit supports. COR 2020 transition is a big topic now in the market right now. We do have a number of clients who come to us where we actually hold their hands and take them through, whether it's COR, ISO, certification programs. And we have created the SME support for small, medium-sized businesses with their journey in implementing health and safety programs. Our training, we are ministry-approved training providers for Working at Height, CPO approved for Working at Height, Joint Health and Safety Committee. And we tend to be in the technology front. We tend to always be in the forefront when it comes to blended programs. So we do have e-learning options available as part of all of our offering. And the other unique pillar that 4S offers, which kind of ties the whole thing together, is the software piece. So the ForSafeCom software that brings and helps our clients sustain their program and keep it alive with their workplace inspections, online training. It comes with the LMS, accident management, stats, job safety analysis. So job safety analysis is the foundational piece of this whole process. So that is what we do at 4S. So it is a one-stop shop when it comes to implementing a sustainable workplace health and safety solution. We do focus a lot on middle management training because middle management is the piece that kind of helps you keep that, the binding agent that keeps the whole program alive. So today's agenda, we are going to have CPO present his strategy for 2022. Then the training division of MLTSD will be giving updates on some of their initiatives, including the health and safety reps training certification program updates, followed by WSIB, who will be going over the various different incentive programs, the Safety Excellence, the SOSE program, the alignment of COR to the Excellence program. So these are some of the topics that we will be covering today. So our first presenter is going to be Joel Modi, and at this point, I would love to pass it over to Sabesh Kennagaratnam, who's our CEO at 4S Consulting Services. Thank you, Sabesh.
Thank you, SOSE. And thank you, Dr. Joel Moody, for joining us. You're fast becoming a person who doesn't need an introduction anymore, but I will have a great introduction for you. Dr. Joel Moody has been appointed as a Chief Prevention Officer and Assistant Deputy Minister for the Ministry of Labour, Training, Skills Development since September 15th, 2021. Dr. Joel joins the ministry from the ESA, where he held the role of a Chief Public Safety Officer and Senior Director Analytics. He's a seasoned public health and occupational health and safety leader with over 17 years experience working in various labor organizations throughout the province of Ontario. As a member of the ESA senior leadership team, Joel led its future strategic direction to achieve its getting to zero vision of safety in Ontario. He led numerous high-profile projects, which included developing strategies and tactics to combat electrical fires in high-rise occupancy residential structures impacting over 6,000 dwellings in Ontario, resulting in the City Council changes to bylaws requiring multi-residential electrical maintenance plans. He has championed innovative approaches to harm reduction and regulatory oversight and made equity, diversity, and inclusion central to his philosophy of leadership. Furthermore, his ability to build and maintain strong relationship with stakeholders, as well as his passion for worker health and safety is well known throughout the health and safety sector. Dr. Moody has an executive education certification in strategic management of regulatory and enforcement agencies program from Harvard University, a doctor of medicine and an advanced certificate in epidemiology and biostatistics from George Washington University, a master of public health, international health epidemiology from University of Alabama, and a Bachelor of Science in Engineering of Civil Engineering from Duke University. And Dr. Moody has been doing some incredible work in the last little time, which will probably will shadow everything he's done. And I'm very proud to have him here. Dr. Moody, back to you, Sobi.
Thank you so much, Sebash. Before Dr. Moody takes over, Kate couldn't join us today, but we have Richard Burton, Manager of Health and Safety Training Administration, and Annie Siddiqui, Manager of Training and Awareness Unit, who would be joining us, followed by Dr. Moody's presentation. Thank you so much, and I'll pass it over to Dr. Moody.
Well, Sobi and Sebash, thank you so much. It's always a pleasure for me to come and speak with you. And Sebash, your words are always too kind. It's really the work of the system. And that's where, I find my energy. And that's where, I find my passion. It's through working with all of us in order to meet the needs that we're trying to do. So I want to say thank you very much for offering the invitation for me to come and speak with you today at the seminar. And it's really about continuing to provide those connections, because as we work together, what we're trying to do is really create the plan. And so how do we now operationalize or put that plan into fashion? So as you said, Sebastian, I've been here about 6 months now. Hard to imagine that time flies so quickly, but definitely having a great time. So as we said, I've been asked to kind of talk about the provincial strategy. And so in July of 2021, the ministry released its next occupational health and safety strategy called Prevention Works. And what the strategy is designed to do, it's really to outline where do we want Ontario's occupational health and safety system to take action. And what action are we trying to take? It's about improving the health and safety of the workers in the province over the next 5 years. It has both immediate as well as longer term goals, because at the end of the day, I think we all want to be able to say that Ontario is the safest place to work. And I know that that's our ultimate goal. So on the slide, you'll see here, it has 4 objectives and 2 system focus areas. And so these were based upon, extensive research, provincial-wide consultations, both employers, labor management groups, the Prevention Council, many of the people you see here. I see Rod, you're here, so thank you for your input as well. But it's through these consultations that we were able to have a very coherent group of options and opportunities. And that's what I wanted to kind of talk with you about today. So one of the objectives that we talk about very first on is about how do we use data and evidence, okay? So that opportunity to use data and evidence to implement risk-based interventions that will strengthen occupational health and safety knowledges and practices, not only amongst employers and the workers, because we want that to be on the ground. And actually, can you go back to the last slide, please? Yeah, we'll just stay there for a second. So we want to then look at the second objective, and that's, how do we help workplaces to not only comply with their occupational health and safety laws and standards, but to improve their knowledge and the practices. And this is really about focusing on training, improving access. We want to have good quality training. And how do we do so? It's by demonstrating the outcomes and testing them. So that's kind of our second objective. The third objective, and I think Rodney and others will be talking about this a bit later, how do we support the businesses, especially those workplaces, to achieve excellence through the participation of incentive programs, such as the WSIB's Health and Safety Excellence Program, the ministry is supporting Ontario Health and Safety Program. Because once again, the opportunity to provide those incentives for people that go over and beyond because they've demonstrated that they understand the importance of health and safety, so important. And then the last one, focusing on small business. Because at the end of the day, we know that small businesses not only have occupational health and safety that they have to comply with, tax law, meeting payroll, and then actually doing the job that they want to do and love as they started their business. So how do we find ways to make the obligations seamless? How do we find ways to support them to make that burden easy? Those are the things. And especially when we're coming out of COVID, it's been very apparent that we have identified some barriers and gaps, especially as it relates to our small businesses. So in the next few months, we will be engaging our small businesses to do a survey with them to learn more about how we can support them and especially overcome those barriers that have been identified. Another area of system focus that's so important is this concept of occupational illness, work-related mental health, violence and harassment, including racism. And so this will involve both our stakeholders from within the occupational health and safety system, but as well as some of the non-traditional stakeholders outside of the occupational health and safety system, because it's through those partnerships, it's through the joint initiatives that I know we're going to receive the greatest impact, because many of these aspects are societal impacts. They've been with us, but we know that that's not what we want to have within our workplaces. Because as we talk about employee health, having an employee that's well, they will then have the best productivity because a well workforce is a productive workforce. So as we're moving the occupational health and safety system toward evidence-informed, risk-based models of prevention, how do we do so in a continuous fashion with measurement? So through the strategy Prevention Works, the system will be better able to identify those systemic issues that we talked about and how they contribute to the risk of injury, the risk of death, the risk of disease, because we know that we want to prevent that from happening. A lot of work is underway under this umbrella. For example, within the ministry, we've had CPO training programs underway, such as the Joint Health and Safety Review, as well as working at heights. But I will be remiss if I didn't also talk about what we've currently gone through over the last couple of years with COVID. As we get the strategy into full swing with implementing the strategy, we can't forget about the pandemic that is still with us. It hasn't been easy. When all of this started in March of 2020, most employers, most workplaces never had experience with dealing with a pandemic, an outbreak, this communicable disease that we talk about called COVID-19. But it's within that context where we have seen great dedication, the flexibility, the creativity that many of the businesses have had to do to respond to COVID. And I definitely want to say that I congratulate you because you have done an extremely good job in order to find ways to manage those challenges and especially those pressures that are within our businesses. So as the COVID-19 mandated restrictions are ending, we still need to continue to support our workplaces. So at the ministry, we are ensuring that we are in constant connection, in line and step with the Chief Medical Officer of Health, our Ministry of Health, because that's where we take our lead, and that's where we work very closely to ensure that we are consistent. So I want to continue to ask the system partners, our network, to help get the word out about the key messages. As many of those, the requirements are rolled back, the Occupational Health and Safety Act is still with us. So still remember our obligations. Although not required, the safety plan is part of our best practices and suites that we would like to continue to do for your planning activities, because it helps you to think about the risks, the hazards, the challenges that you may face, but it also helps you think about what are the options that I have as we continue to work through this pandemic. But all of this can't be done without having a culture of health and safety. and not having a robust culture of health and safety. So I just want to take a couple of minutes to talk about that. I know I'm speaking to the converted that are on the webinar today, but we know that it's not always the case. It's not always the case that companies have an integrated, ingrained health and safety system that's part of their workplace culture. So it's by building this culture across our province, that is what we want to use as the foundation of our prevention system. And that is what is going to make Ontario a safer place to work. Having that strong health and safety culture is about the shared values, the beliefs that we need to be ingrained from top to bottom, with leaders setting the tone. And SOBE, within your opening remarks about the 3 different groups that 4S does, very important around the systems, the people. And so that safety culture, understanding what influences culture, understand what influences your organization that can make significant contributions to changing those attitudes. Very, very important. So it has to be led at the top, embraced and practiced by the CEOs, the senior managers, because the research is very clear. Strong leadership and management that are committed is directly related to improved safety performance. It demonstrates by example to the employees what actions are rewarded, what actions are tolerated, and even more so what actions are not accepted, which in turn influences many of the actions, not only on the work site, but throughout the larger safety community as a whole. So just to finalize for a little bit, the pandemic has certainly highlighted some of the gaps and barriers and inequities that exist within our system. Not all of the workplace's response have been equal, and there's continued work that needs to be done to help to provide always clear, consistent advice, not only from the public health measures, but as well as the workplace measures, such that we can all understand and act upon it. So with an individual's responsibilities, we've seen the majority of the workplaces take this very seriously. Workplaces, the workers, the parties themselves have worked collaboratively, and they've been able to collectively identify the challenges, the barriers, the risks. Because at the end of the day, we want to be able to share information. What are the ideas? What are those best practices? Because they all contribute to our common goal. And that is the area that we're constantly striving for. How to identify, control exposures, and create an environment that is focused on the total worker well-being. I know we all share that goal just as much as myself, because we do want to make Ontario the safest place to work. And that is a place where health and safety is at the center of everyone's work. So SOBE, Sabesh, thank you so much for having me this morning. And I return the podium back over to yourself. Thank you.
Thank you, Dr. John Modi, for helping all of us understand the strategy that you have. Those of you who are interested in asking questions to Dr. Modi, you can type your questions in chat, but we are going to let the MLTSD training department do their presentation, and towards the end of their presentation, we will take 10 minutes to answer the questions that's pertaining to Dr. Modi and the training department before Rodney does his presentation. Thank you so much. Richard, I'll pass it over to you and Annie.
Okay, thank you very much, SOBE, and hello, everybody. I'm glad to be here and to give you kind of an overview of what our branch is about in Training Awareness Branch, as well as some of the initiatives that are running right now at different stages of development, consultation, or they're actually programs now that are running. So just a quick overview about our branch, Training and Awareness. Most of you are probably aware that way back many years ago, we launched the Occupational Safety Awareness Training e-learning modules. They're on our website. So, those are some of the products that we offer out there for employers, for supervisors and for workers, to get that basic level of awareness training for occupational safety. They're mandated by regulation, and they are self-service. You go in, log in, take the training, and away you go. And you can print out a certificate at the end of it. So that's one set of products that we cover within the Training and Awareness branch. during COVID, and Dr. Moody talked about the COVID adjustments that have happened over the last 2 years. Our branch was worked heavily with our training partners, our safety associations, on developing an infection prevention and control online e-learning program that was pushed out in 2020 to help support workplaces with understanding what is this whole COVID thing about, what are the potential hazards, etc., and roles and responsibilities when it comes to that. So a very successful program there. Again, that was sort of launched through the ministry, working closely with our funded safety partners. And then, of course, a couple of staple programs that have been out since, I guess, Joint Health and Safety Committee certification goes all the way back to 1994-95 and has evolved many times over. So we've established and managed the standards for Joint Health and Safety Committee certification training. And as well, in 2015, Working at Heights was a new program standard that was set forth by the Chief Prevention Officer at affecting workers in construction sector. We'll talk a bit more about those two programs, particularly in the reviews that have been taking place, etc. So that's kind of a very quick overview of our branch. And then we'll get into some discussion a little bit later on some of the new initiatives. So we can move to the next slide, please. Okay, there we go. So here's one of our newer initiatives that launched in 2021, and it's the Small Business Health and Safety Training Program. So as everybody knows, if you're in a workplace that has between 6 and 19 workers or employees, there needs to be a worker health and safety representative at that workplace. But those particular workers who have functions, much like somebody on a safety committee in a bit of a larger workplace, they don't necessarily have to have training. But to carry out their function properly, they need to get some form of training to be able to do proper inspections, make recommendations to the employer, maybe participate in investigations accordingly, that kind of thing. So in 2021, the ministry launched the Small Business Health and Safety Training Program, which is a kind of a refund program to support employers who are struggling through COVID, but need to get their people, they need to get health and safety reps trained up so they can carry out the functions properly. They offered a reimbursement program. So you register for health and safety training, small business health and safety training, which is the health and safety rep e-learning curriculum, go through one of our health and safety associations, and then reimbursements are available for employers by application, and the reimbursement would give you $25 toward the cost of registering for the program, the e-learning program, and then $150 toward the cost of participating and taking the actual training. So for a total of $175. So that program has launched. There's been a commitment over 3 years for about $10.5 million to train up about 60,000 health and safety representatives in workplaces in Ontario. It's a great initiative because, as I said, health and safety representative training is not mandated in the Act or in any regulation, but this is a great way to support workplaces and the internal responsibility system and to achieving excellence in health and safety overall. If we move to the next slide, please. Supporting Ontario safe employers. So we heard Dr. Moody quickly talk about that, and SOBE introduced SOSE as part of that excellence stream that you were here to talk and listen to. So for many of you, this is probably a brand new program. Supporting Ontario Safe Employers is a ministry program. It's run out of the Chief Prevention Officer jurisdiction. It promotes implementation of accredited occupational health and safety management systems in the workplace and helps reduce injuries and illness. Sorry, I just had to refresh with my water. I apologize. And there are two parts to this particular program. One is accrediting an occupational safety management system. The Chief Prevention Officer has established standards, and what was done were 4 systems were accredited, and we'll get to that in a couple of minutes, by the Chief Prevention Officer. So any of those 4 systems can be used by employers, and they can then take on the second part of the program, which is implementing that particular system and applying to the Chief Prevention Officer for recognition as a safe employer. To support the program, in 2016, the ministry provided some level of guidance around what is a health and safety management system. And as we can see right here, the definition really talks to it's a coordinated system of procedures and processes and measures. So that involves all kinds of things: risk assessments, training, procedure development, inspections, investigations, audits, and so on and so forth. So all kind of tied together. And then, as Dr. Moody had mentioned earlier, it works as well as it is led. And so the leadership commitment in a health and safety management system is extremely important, because everybody sort of follows the direction of our executives and the leadership in the organization. And if there's a clear commitment to health and safety, then health and safety will live and breathe well in an organization. If we can move to the next slide, please. So again, Dr. Moody had mentioned this as well about talking to people who are converted, but I think there may be people in the actual meeting today that have not implemented a system. They may be thinking about implementing an occupational safety management system. We heard SOBE mention the kinds of services that they offer to support you on that particular journey. And you'll also hear a bit more later on from Rodney Cook from the WSIB, how they're already supporting employers. So, but there are benefits from all of this, and Dr. Moody mentioned a couple, but I just want to sort of elaborate a little bit further. Improve safety environments. When you have a health and safety management system in place, it's a clear commitment from the leadership. It's a demonstration that they care about the well-being of workers, and it's exemplified by risk assessments, including workers in sort of from a participation perspective, including them in from an input perspective on what do they see is appropriate for a solution in health and safety to make their lives and their work environment safer. And so you gather input and you see that input reflected in the actual work and the safety outcomes for the individual worker or at a particular workplace or workstation or within the overall workplace. If you have workers that are seeing that the workplace is caring about them and safeguarding things, they're going to be happier. They're going to be more productive. They're not getting injured. Nobody wants to get injured. Nobody intends to get injured at work. And injuries at work can be debilitating and very serious. In worst case scenarios, they can include death. So if they know an organization is caring about them, that increases morale, and morale increases employee retention. So it's kind of it's sort of a self-fulfilling prophecy in terms of I start to do things better for my people. They return the favors by doing things well for your organization. It also, workers will also talk about things that are going on in the workplace. They talk about good and bad things. If you're doing the right things, that kind of information starts to get outside of your business. That may actually start to feed into recruitment strategies, or people referring others to come to your workplace to work. So you may be getting top talent by actually implementing key health and safety management systems in workplaces. Overall, at the end of the day, you want to keep workers safe. If workers are safe, you're reducing the numbers of injuries and the associated compensation costs, plus other kinds of equipment and other types of damage that may not affect an individual, but could affect the business as a whole. And then finally, what we're noticing more and more is that organizations that implement health and safety management systems are facing two things. One, if I'm an organization who wants to put tenders out or contracts, I can now sort of ask through the contracting process for pre-qualifications. Organizations saying, look, you know what, I want to know what your health and safety climate is like. I want to know what your policy and program looks like, and your procedures, your accident statistics, because I want my work sites and any worker contracts we have with you to reflect the image that we want, which is overall safety for anybody who is doing work for our business. And vice versa, we're finding more and more applicants are being asked to demonstrate when they're bidding on contracts their own health and safety programming and what they're doing about safeguarding their workers. So for me, there's also a greater social responsibility when you talk about that. And those are some of the key outcomes and benefits from implementing a health and safety management system. If we can move to the next slide, please. So I mentioned there are four occupational safety management system standards that have been accredited by the Chief Prevention Officer. The CPO does have a standard, and all of these particular systems on the slide here have met the CPO standard. So in the construction sector, I imagine many are quite familiar with the IHSA's COR 2020 product. And in many of the industrial environments, we see a lot of applications coming in for ISO 45001. They tend to be two of the more prevalent products out there in the marketplace right now. Okay, and if we can move to the next slide. So this is the application process. So if I want to get recognized by the Chief Prevention Officer as a safe employer, what do I have to do? Well, the first thing is, it's kind of a 6-step process here, but the first thing is you have to implement an accredited health and safety management system. So it's got to be one of the 4 that was on the previous page, on the previous slide. The employer has to make a decision about what would be the appropriate system for them. They make that selection, and now they have to then start to gather up resources about how am I going to go about doing this implementation. This is again where organizations need to sit there and assess for themselves, what do I need to do to fulfill the implementation of this system? I may need certain types of procedures. I'm going to have to do certain types of training. I may have to set up a committee within the organization to focus solely on the implementation of this. There's a whole plan behind it, etc. Some organizations have the capacity to do it themselves in-house. Others will hire consultants and get feedback from professionals and experts. At the end of the day, when the system is implemented in your workplace, you'll do some pilot audits within the workplace to make sure it seems to be running properly. Then at some point you have to conduct what we call an independent third-party arm's length audit, right? So somebody else who has no attachment to your business comes in and they do an audit of your safety management system implementation to make sure it conforms to what was established as to the standard. You have to arrange for that. You can usually go to certification bodies or bodies that are acknowledged by the CPO as a governing body for auditors. You get the auditor, they come in, they conduct the audit, they will give you a report. You may have to make some corrections before they can close out the audit, or you may be successful and it's been fully implemented. They certify that, you'll get a certificate. And then what happens next is once you have that certificate or that final audit report that shows that you fully implemented a health and safety management system at your workplace, you can then come to the ministry's portal and submit an application. The application has to come within 12 months of achieving your certification. And I just want to stop there because I've had cases where people confuse the employer recognition by the CPO with certification to a safety management system. So right up to the point of application, the CPO really doesn't do much. We don't certify you. We don't conduct audits. We don't identify audit organizations for you. That is really in the hands of the employer. But once the application is received, we're now going to check to see, is it a bona fide audit? Was the auditor credible? Are they in good standing? All that kind of stuff. So that's when that's the differentiation. You're already certified to a standard, to a system. We're just recognizing that, but we also have some other things that we have to check for. So if you move to box 4, application review. So there are certain criteria that we check within the ministry on compliance. As an example, does the company have any outstanding orders for failing to establish a safety committee at the workplace? Or have there been any recent decisions by the Ontario Labour Relations Board that said the employer or an agent of the employer reprised against a worker, and it's a finding that there was a reprisal. So we will look at those kinds of things, as well as prosecutions and convictions and prosecutions. If you clear that hurdle, then a recommendation is made to the Chief Prevention Officer, and the CPO can then recognize the employer, and incentives that are what I call non-financial in nature are available through the CPO's office. You will be listed on our website as a safe employer. You will get a letter from the CPO that says that you are recognized. You will receive a certificate with frame that you can then sort of hang on your wall and display. As well, we do have, so some organizations like the idea of being able to use identifiers to show I'm recognized. So there will be, I call peel and stick labels that are available for you to put on equipment or to do whatever you like with, to demonstrate and promote how you have been recognized by the Chief Prevention Officer. So those are the kinds of non-financial incentives available through the CPO for recognition. Next slide, please. So just to give you a sense, in 2021 is when we really started to get going on applications that we're starting to run in 2020, 2021. This is just to give you a quick snapshot of where we are. We've had since in 2020 and 2021 combined, we had recognized 8 employers, and between those 8 employers, they received a total of $308,000 worth of incentive from the WSIB. The ministry does not administer that incentive program. That is a WSIB program, and there are specific requirements to qualify for that. What we do is once you are recognized as an employer that's safe with the CPO, we then make a referral to WSIB to say, look, this organization has been recognized by the Chief Prevention Officer, and then and they've asked for us to refer their name to you for consideration under the Ontario Safe Employers Rebate Program. And so, you know, Rodney can talk a bit more about that if he wants, but my understanding is that it's designed to provide some kind of relief for the investments made to implement a health and safety management system. There's clearly not going to be a one-to-one cost relief to this, but it's a means to recognize the effort made to get to that level, okay? And I think we can now move to the next slide. So some training updates. Next slide, please. So very quickly, so Working at Heights training. In 2015, Working at Heights was established as a mandatory training program under the Chief Prevention Officer. At the end of the day, most workers in construction projects who work at heights required to use a certain method of fall protection must have Working at Heights training. The training can only come from approved CPO training providers using an approved Chief Prevention Officer program. As you can see here, just under 1 million learners have gone through Working at Heights, and either it's the full program, or it's the refresher program. In 2018, refreshers started to kick in. So your training is valid for 3 years, and then you have to take refresher to continue to work at heights after the training goes invalid. It never expires. It just goes invalid until you revalidate through training. And there are currently right now 213 Chief Prevention Officer approved training providers who deliver this training program. So there's lots of choice in the marketplace. Next slide. So any good program, we have to be able to measure that it's doing well. So in 2019, the Institute for Work and Health, which is a key research organization when it comes to occupational safety matters, they conducted a study on Working at Heights and the impact of the particular training to see what impact it had. And so some of the key findings were, they noticed typically that for sure there was increased quality in the training of Working at Heights. So before Working at Heights training came in, it was a bit of a wild west in terms of what you could predict or guarantee would be the level of quality in the training. This really helped to sort of rein all that in and get us very, very consistent and bumped up the level of quality in all that kind of training to make it a lot more consistent, and it more easily supports portability from one employer to the next, one construction project to the next, etc. So that was one thing, that a key observation that came out of the training. It had positive impact on safety at work sites. Workers had larger retention times in terms of the knowledge that they had. It was clearly indicated that fewer injuries were happening from falls, which is a net savings to the insurance system, but as well it's reduced lost productivity time for employers if the injuries aren't happening as much. And it keeps the community happy because people in the community aren't getting injured seriously from a fall and people aren't dying. So the same kinds of positive impacts were there. And then, we never knew going in exactly what the market size was for learners that were going to require this training. We estimated it could be anywhere between 350 to 480,000 workers, but we're not sure. But clearly from the numbers of people trained over the course of the Working Heights implementation, we believe that 70% more learners were trained than what was originally forecast. And as you can see, we're up to 920,000 total for both the original plus refresher. So everything was positive on that front. Nothing is ever perfect, but clearly things are all pointing in the right direction. Moving to the next slide, please. So after that study came out, we had to turn our focus to the standards themselves. There are both a Working Heights provider and a program standard, and those have embedded within the standards sort of a commitment from the CPO to conduct a review about every 5 years. So the review for Working Heights was undertaken over the last year and a half. And results have been sort of distilled. And so some of the things that were observed, if you take a look on the right-hand side here, obviously there was some call for additional types of equipment to be included in the training, and workers particularly had vocalized that they wanted more training around ladders. So ladders was the key function that people wanted to hear about. We get inputs from what they call CORs, or coroner jury recommendations. So whenever there's a workplace death, a coroner can call an inquest, and then there's a jury that's on the inquest that can make recommendations. So as you can see here, skylights became an object of focus because there had been a few coroner jury recommendations around skylights. People have fallen through skylights and died. So as an example, so some new equipment has been brought in. We noticed that the learning ratio was never reaching more than an average of about 8 or 9 workers to 1 instructor. So that particular ratio was lowered to a 12 to 1. And then particularly around code of ethics. So in the current climate, everything started really to gear up about anti-racism in 2020. We know about all of the events that went on. And it was clear to us that the training provider standards needed to have a better strengthened code of ethics around anti-racism and social inclusion for the learning environment. So, we always talk about in our standards a safe learning environment, but there's opportunity there to make those kinds of improvements. We did have a technical session with all the training providers 2 or 3 weeks ago to kind of give them a heads up as to what are the changes are anticipated to come. We're still waiting for the standards to be posted. They should be posted in the next few months. And then we will then be transitioning to a new set of Working Heights standards. But that will not affect learners who are already valid and trained. So, as long as they are valid, their training stays valid until their next refresher. And if that refresher happens to be, say, February next year and the new standards are in place, well, then the refresher just automatically gets adjusted based on the new standards. So the workers do not have to worry about anything new. They just go to the refresher course as an example. Okay, moving on to the next slide. So the other thing, the other main CPO program in training is Joint Health and Safety Committee certification. This is a multi-sector program, cuts across all sectors based on workplace size. The model is such that part one is kind of, I call the basics of occupational safety, and part two is really a hazard-focused module where you're applying hazard management principles to 6 hazards as a minimum. You need to complete part one and then part two in sequence, but the two combined will then get you certification. So as long as you're successful in both part one and part two, you then become certified. And then after being certified, every 3 years, you have to go through a refresher program. That program, as I said, I think that came in 2016, the most recent edition of the main standards. There have been small adjustments along the way. One of the adjustments along the way was part one was originally only classrooms for 3 days. We had introduced a blended program as well. But part one now has an e-learning option that's only 2 days. And I think SOBE, I think your team is actually one of the part one delivery agents for, yeah, exactly. So, it's still a 5-day program in class, 4 days if you take the part one fully online. And the refresher is just a 1-day return. So but it was time. The program's been out there since 2016 with the small adjustments. It's time to look at that standard and to do a review of it. Next slide, please. And so we are this year going to undertake a review of Joint Health and Safety Committee certification training standards. We started kicking things off sort of latter part of 2021, but this kind of gives you a sense of what the process is going to look like. We're kind of early into the process, but there's always going to be a research bucket where we do jurisdictional scans, take a look and see what other jurisdictions are doing around things. There may be academia research that has happened around Joint Health and Safety Committees and effectiveness, and is any of that information in academia relevant to our particular review? Then, a provider survey. So conducting a survey with training providers of Joint Health and Safety Committee certification. They have sort of on the ground experience and knowledge about what works, what doesn't from a provider perspective, and development and sort of dissemination of a survey to learners. We did the same thing with our Working at Heights review, as targeting a series of questions to learners to get their input. So I took the Joint Health and Safety Committee certification training. What was my experience at the end of the day, right? Did I take part one only, part two, refresher? Have I done all 3 in the last 5 years, whatever it might be, to get a real sense of how does it working for them, right? And is it a good program? Are there ways to improve it, etc.? We get that information, and then we're also going to go out with a public consultation, which will be the principal tool to get stakeholder feedback from across the province on how well Joint Health and Safety Committee certification works and whether there's opportunity for improvement. Take all that back, a process piece around input analysis. We take all that data back, look at it, analyze it. And then within the ministry, there's always conversation about what is the implication, how does it work, what can be done, what can't be done, and then revised standards will come out. I don't have a specific timeline in the revisions to the standards when they would be coming, but I can say that the intent is that we will be in consultation in 2022. So that said, likely not till sometime in 2023 before we see revised standards, but I can't be precise on that. That's still a bit of time out. But there you go. That kind of deals with the Joint Health and Safety Committee certification standards 5-year review. You will be notified through our training providers, through public consultation, the consultation site that we have, the Ontario Government Registry. You have access to that as organizations if you want to provide input to this consultation when it launches. Okay. And I think that's really what I wanted to say. So thank you. I think I went over time. I apologize for that. And I will now stand down for a couple seconds.
Thank you so much, Richard. Great information. I'm sure it really helps the audience understand their responsibility for workplace health and safety and the expectation from MLTSD. There are 5 questions that has been posted. Maybe we'll take exactly 5 minutes to see if we can go through these questions, because I know Rodney has quite a bit to cover. So I do want to give him the time to go through his slides as well. As of now, there are 6 questions that are submitted. So I'm sure that you can look at the questions in chat box between Dr. Moody and Richard if you do want to take a chance in answering some of the questions. I mean, I'll actually throw one question here that seems to be a common thing that people are talking about. Will IHSA COR be accepted for SOSE? There's rumors that ISO 45000 gets preference. So Dr. Moody or Richard, any one of you?
Yeah, I think I'll just kick in. I think, once again, as far as process, Richard has done a very good job with outlining, the steps that are required, because under the legislation and the program, full implementation of the standard is what is required in order to be designated as someone, as a business that has to be accepted by the CPO under SOSE. Richard, if you could add any additional thoughts.
Yes, that's correct, Joel. So there's several questions here about, I guess, so the recognition or the accreditation of COR and COR 2020. So yeah, you absolutely are correct. So it requires full implementation of occupational safety management system, which means, for our purposes, if somebody gets an audit and their audit score basically is not 100%, then, and that means they get a bit of an action plan that they have to fulfill. Once they fulfill the action plan, then for the purpose of recognition, once all those action items have been addressed and validated by a third-party auditor, then the application can come in. So, so that's kind of the process with respect to audits and validation of an implemented health and safety management system. Doesn't mean you can't be certified. I do know that I think COR 2020, I think you can be certified at a pass mark of around 80 or 85%. So, but for the purpose of CPO recognition, you have to achieve full implementation, which in our view is an audit result of 100% or less than 100, but then all action items are implemented or non-conformities are implemented and validated again by a third-party auditor.
Thank you so much, Richard, for taking up that question. I think it clarifies a lot of things. I can also add a little bit of context. Being a COR external auditor and supporting over 100 plus clients with COR and ISO, I could give a little bit of context. The COR 2020 program is the replacement of COR 2015. There were gaps in COR 2015 with alignment to ISO 45001. That's why COR 2020 was introduced to actually bridge those gaps. So in order for you to apply for the SOSE program, you have to have COR 2020. With COR 2015, you cannot apply for the SOSE program. You have to have COR 2020 alignment done, accepted in order for you to apply for the SOSE program. That should set clarity to all of you who have that question, because with the current COR 2015, majority of the 800 plus organizations, 300 plus organizations who are COR certified at this moment have to go through the full transition into COR 2020, which is the alignment of 45001 to the international standard. So the SOSE program was pretty much developed based on ISO 45001 standards, and they actually, CPO's office accommodated COR because there's a large number of constructions company who have COR certified. They didn't want to leave them out because their program, when we talk about safety management system, is the implementation of risk assessment, developing policies, procedures to mitigate those risks, providing the necessary training, then managing the program with inspections, investigations, the whole program together. So that was the clear understanding that everybody needs to understand. If you are COR certified currently based on 2015, you do need to upgrade your program. You have time till year 2024 to make that transition happen. But if you have external audits happening after October of this year, 2022, then your program have to be transitioned before the external audit. Up until October 2022, if you still have external audits, you could still get through with the 2015 program. That is a greater level of confusion there are for many people who are COR certified. My understanding, working with the various different associations, there should be no preference between ISO or COR. It should be the same. Right now, there are more ISO companies who have got their SOSE program approved, while COR is still taking time, but I'm sure it will get caught up. Dr. Modi, if I did say something that is not in alignment, please correct myself.
No, I think, having someone that takes part in the process to be able to speak on kind of the on the ground aspects is very important. So thank you, Sobi.
You're very welcome. And there was one other question that was not really related to COR or ISO. Is there a refresher online? If not, why? I'm assuming they're talking about Joint Health and Safety Committee training. Currently, online is accepted for the 3 days of in-class training. You could either do in-class or virtual 3 days. If not, it have to be online. Those providers who have online can do the online, which is 16 hours online. But right now, Richard, I'll let you speak for that, because that's a question that is directly at your department. Why refresher is not online yet, right now?
Yeah, so refresher is not currently an e-learning product, which I think people tend to equate with online. I tend to split hairs on what online means. When I do a virtual conference like this, you're going through the website. You're going through websites. I see this as a virtual online course. It's not e-learning. So you can do this distance learning mode for refresher. Now, that said, I think all comments will be considered in any consultation that we alluded to earlier for Joint Health and Safety Committee certification training. So I think that's clearly an area that if people would like to see that as an online offering, those are the kinds of comments we'll want to hear about in the consultation when the paper is launched. Okay.
Thank you so much, Richard. And I'll take one more last question. We do need to move on to the other presenter. What is the major difference between IHSA COR and ISO 45001? Richard or Dr. Moley, do you want to answer? If not, I do have the answer, so please.
Well, so I can give you a quick bit, Sobi, and then you can maybe plug in on yours. So we see them as pretty close to equal, simply because the leveling factor is the Chief Prevention Officer's accreditation standard, right? They both meet the accreditation standard. So that's how we measure the equivalency, is basically using the CPO's accreditation standard. They both meet the standard. So in my view, they're both alike. Now, that said, I recognize that it grew out of a construction sector initiative for the COR product. So it's going to probably focus a little bit more on organizations in construction, but I've looked at a lot of the questions in that particular audit tool, and they can cut across industry. So that's kind of where I'll stop right there. So you can add anything else, Sobi, that you'd like.
Thank you, Richard. The big differentiator is COR 2015 it is not in alignment with 45,001. It is COR 2020. That is why everybody is asked to go through the transition, because that is in alignment with ISO 45,001. There are 4 major elements that was missing in COR 2015: management of change, management of reviews, or especially document review process. That whole piece was missing. Record management, record control, contractor management. So these are some of the essential pieces that was missing from the 2015, which is being, the gap has been bridged with 2020. So it is crucial for each and every one of you who are on this call who have COR 2015, you do need to do the transition so that it is in alignment. Okay, with that, let's move it over to Rodney Cook, because he has quite a bit to cover about the incentive. So Subash, please introduce Rodney to everyone. Thank you.
Thank you, Sobi. Thank you, Dr. Moody. Thank you, Richard. Hope to see you all in person soon. I'd like to introduce Rodney Cook. Rodney Cook is the Vice President for the WSIB. And for more than 20 years, Rod Cook has been a leader in business transformation in both private and public sectors. Currently, Rod is the Vice President of Workplace WSIBs, and he oversees all aspects of workplace health and safety programs at the WSIB, with a focus on being at the forefront of innovation and creating a culture of health and safety in Ontario. In 2019, he led the launch of a digital-first program, the Health and Safety Excellence, which provides a clear roadmap for businesses to improve their health and safety culture and practices leading to injury and illness avoidance. Shortly after the launch of HSEP, the team received an international recognition by winning a Bronze Stevie Award for sales and customer service under the COVID-19 response category. Before joining the WSIB, Rod spent 4 years as the Vice President of Human Resources, and under Rod's leadership, the WSIB was awarded the Mental Health and Work Silver Level Certification from Excellence Canada. In 2018, Rod was awarded with the Morley Gunderson Prize by the University of Toronto to recognize and honor his outstanding professional achievement and service to the Centre of Industrial Relations and Human Resources. Most recently, Rod was appointed to the Provincial Council as one of the advisors to the Minister and the CPO. Rod serves on multiple board of directors, including the National Institute of Disability Management and Research, the Pacific Coast for Workplace Health and Safety, Health Sciences and Excellence Canada. Rod has a bachelor's degree in economics from Concordia and a master's degree in industrial relations from the U of T. And Rod also earned the CRSP designation in 2020. Glad to have you back, Rod.
Great, thank you very much, Sebastian and Sobi, for the invitation. And it's always great to be here as part of the health and safety system in Ontario with Dr. Joel Moody and Richard Burton as well. There is a lot of material here. I do have a hard stop at 3:30. So I'm going to do my best to cover the material in the time that I have here. So I'm going to jump right into it. I'm really going to focus on the Health and Safety Excellence Program and the practical application of so many things that we've talked about today. There's great business reasons for investing in health and safety, and those have really, I think, shined through in Joel and Richard's presentation. So let's take a really good look here at the many businesses that are logged in and hearing about practical application of what we're talking about. And a shout out to, I know on the list here, there's a number of businesses who are involved in the Health and Safety Excellence Program. And there's about 100 or so who should be signing up for this program, or I don't even care if it's this program, some sort of investment in health and safety, because you want to distinguish yourselves from your competition, and it makes good business sense. So a little bit quickly on 4S on the next slide, please. 4S has been on this journey with us with the launch of the Health and Safety Excellence Program from the beginning. I think what's really fantastic is there are 45 businesses currently enrolled, and they've given almost $500,000 through WSIB, helping businesses be successful in the investment of health and safety, and almost $500,000 have been rewarded back to businesses. And what I really like about this story with 4S is the number of small businesses. 47% of the those enrolled are small businesses, and that is something that's really important as health and safety leaders, because 89% of businesses in Ontario are small, and we need to find ways to work with them and help them invest in health and safety. Next slide, please. So very quickly, you've heard a lot about standards so far this afternoon. The Health and Safety Excellence program is not a standard. It's a program that supports any standard that your business wants to go and achieve. That's what's fantastic about how it integrates the system. If you want to go for ISO, sign up for the Health and Safety Excellence program, work with 4S, they can help you achieve ISO. If you want to achieve COR, sign up for the Health and Safety Excellence program, earn rebates, and work with 4S, and they will help you achieve COR. So the destination doesn't matter. We have 36 topics that align to these standards, and I need to include supporting Ontario safe employers in that as well. We worked really closely with the ministry to ensure that at the end of our program, you are ready to apply for certification. So there's a lot of flexibility with this program. Even if you don't want to achieve a standard, you're a small business and you get it that you should be investing in health and safety because it helps you attract talent. It makes for better business outcomes. Sign up for 5 topics, sign up for 2 topics, try it out, and work with 4S, who's one of our providers, and they can help you on the road to improve your health and safety outcomes, and that will improve your business outcomes, and you can be rewarded with rebates and recognition along that journey. Next slide, please. Okay, so I've talked a little bit about this already, but the flexibility with the program, first of all, it's voluntary. So for the WSIB, the Health and Safety Excellence program is our answer to prevention. So we want businesses to invest in health and safety because it can lower your premiums. We want businesses to invest in health and safety because it can reduce claims. What's really flexible about the program, and I've already covered this to some degree, that it aligns the standards, it helps you earn a return on investment. We just recently sponsored the IWH through a grant to do an in-Ontario study on the value of investing in health and safety. And that's going to get published in about 3 months. But Dr. Cam Mustard from the Institute for Work and Health, the result of his research showed this, that for every dollar invested, a company gets a return of $1.24 to $2.14, somewhere in that range. But what does that tell you? Well, it tells you that, hey, if you could invest your personal money into something that gave that kind of return, we'd all be really excited, wouldn't we? Even $1.24, that's an amazing return. So for a business, this is telling all of us that investing in health and safety is a really good investment. So watch for that report. It will be coming out, as I said, in a couple of months. But it really adds clarity that this is a good idea. And that doesn't include the rebates that you can get from the WSIB program. That just adds to the storyline of why this is a good investment. As I noted, those that worked with 4S since we launched this program, $500,000 in rebates. If you look at the totality since we launched this program, we've given $16 million at the WSIB in rebates. We currently have just over 2,500 businesses who have already registered in the program. Then there's the employee story. And I'm just going to summarize that really quick because I think that Joel and Richard did an excellent job. We know that investing in health and safety is great for employee engagement. It's great for productivity, and it's great for attracting talent to organizations. So the storyline is pretty clear. Next slide, please. Okay, let's get to the really practical piece here for all of you. For those that are interested in the certificate of recognition, the COR program, there's three kind of storylines here. One, if you're a COR registered company today, or you're thinking about registering in COR, 29 of our 36 topics in the Health and Safety Excellence program directly align with COR. And I'm going to talk to you about how we've made it easier as well for the validation process. And what I mean by that is we have a validation process with the Health and Safety Excellence program that, once topics are completed, we want to ensure the business has done what they said they were going to do before we give rebates. And we've streamlined that process if you're in the COR program. If you're a business that is transitioning from COR 2015 to the new COR 2020, then we also have made it really easy for those businesses. We have 4 HSEP topics that you can complete, and following that completion, you can be certified for COR 2020. And then if you're a company who's already at COR 2020 and you really get it, and you want to keep investing in health and safety, we've got 7 other topics that you can complete as part of the Health and Safety Excellence program and earn rebates and get recognition through the WSIB as well. So let me talk a little bit about how we've streamlined the process for those that are involved or registered for COR. Next slide, please. So currently with the program, a full validation is being conducted by the WSIB. So let's say you choose 5 topics, you work on those 5 topics with 4S. They help ensure you're going to be successful in the implementation of those topics. Through the digital tool, we're notified that it's completed, and then we do a validation, which is a submission of what you've completed, the topics you've completed, the documentation of what you've completed, and the story of what you've completed. We verify that, and then we issue the rebate. Now, if you're in COR, we've streamlined that process. So all you need to do, if you're in COR, is to show the documentation that you've got your certification, or if you've already been in the program for a while, that you've completed the internal audit, along with a summary story of the evidence that you've implemented, and you will go through the validation process. So we've made it a lot easier. We've really reduced the documentation that's required. We are honoring the COR certification or the internal audit documentation as a part of that process. Now, why did we do that? Because we support COR registration. We want you to go and get COR certified because we know that's good for business. We know that's good for reducing claims, and we know that creates a safer province for all of us, and that's what we're all after. So our program is not about creating work. Of course, there's work to invest in health and safety. You can't get better at something unless you put effort into it. But we want the work to be directly involved with making your business safer. We don't want the work to be around documentation. Next slide, please. So this is just a little bit of the non-financial recognition. If you've ever gone to Safety Check, which is an open data tool, the public can go and see your business on Safety Check and how you're doing with health and safety, those that are registered with the Health and Safety Excellence Program have this digital badge. And whether it's somebody who's thinking about applying to your business to be an employee, or it's somebody who's thinking of doing business with you and they're choosing between a couple of options of where they want to do their business, the first thing they'll see when they open that up is if you're in the Health and Safety Excellence Program, along with a summary of data, which is part of the open data mandate within Ontario. Next slide, please. Okay, a couple of examples for you. What does this mean? So what I've been trying to emphasize is that the Health and Safety Excellence Program can make investing in health and safety easier for you. Not taking away the work, but we connect you to a roadmap, we connect you with the topic so you know what you need to do, and we connect you with great providers such as 4S who can help you implement these solutions. What does it all mean? Well, here's an example of a small construction business who's paying WSIB premiums of $7,000 a year. Predictability says 10%. I'm not gonna get too much into predictability, but I need to touch on it. It's a little bit complicated, but here's this simple version of it. Predictability basically tells us how aligned your health and safety improvements can be to reducing your premium. 10% is low. It means you have less control over your premium. So what do we do at the WSIB? Well, we give you 2% back on your premium rather than 1.4%, which is what those with high predictability would get. But the simple story is you're paying premiums of $7,000. You complete 2 topics. We also have a minimum of $1,000 per topic. And so in this case, you get $2,000 back. You're paying $7,000 in premium, do 2 topics, you get $2,000 back. You like that experience, you come back in year 2 and say, hey, this program can work for us. And we found working with 4S really great. We're going to do 5 topics this year and earn $5,000 in rebates. Next slide, please. Here's an example of a medium manufacturing business. So they're have $50,000 in premium, still low predictability at 15%. So they can earn 2% back per topic. They complete 2 topics. They also get $2,000 back, 2% of the $50,000 per topic. Following year, they do 5 topics and they can earn $5,000 back. Let's do one more example. So here's a large hospitality business. They have $100,000 in premium. They're at 25% predictability, meaning there's better alignment between improving their health and safety and lowering their premiums. So they're high predictability, so they can earn 1.4% per topic. They do 4 topics in the first year and earn $5,600. And in the second year, they earn $7,000 by implementing 5 topics. So it gives you a little bit of a sense of this is on top of all the reasons that we said health and safety is already good. It will help you with your business outcomes. It will help you attract talent. It will help better engage your employees. When people log into Safety Check, they'll see that you're taking health and safety seriously. We've just lived through a pandemic. We all know the reasons. We all know this is really important. We all know that this can create a better business. But we really believe in this at the WSIB, and we're offering financial incentives to help you make these changes. Next slide, please. This is just a quick summary. We'll go on to the next one. So just a little bit about the program itself. As I said, we launched in late 2019, so we've completed 2 years of the program. This is really, really important to me. What do customers say? We did a survey in late 2021. Here's a couple of the highlights. 88% of the members reported they were satisfied or very satisfied with the program 88% also said, I would recommend this to our peers. This is the one I really love because for me, this is what it's all about. 90% of the members reported it improved their health and safety culture. And we know that if a business invests in their health and safety culture, that they will see a reduction in injuries and illnesses, and they will see an improvement in their business outcomes. We know that. Lots of other good research going on that we're sponsoring at the WSIB. Hopefully next time I'm back, I'll be able to share some of those findings with you. But I think we can check. There might be one more slide. I'm not sure. I think that's it though. This the nice light bulb. So listen, I really appreciate this opportunity, Sabesh and Sobi, and for all of the businesses that are listening in. This is where you can reach us if you want to learn more. And of course, as I've noted, 4S is one of just over 20 providers that we have. And we have a long-standing partnership with 4S. Highly recommend you connect with them to find out more. I know that was kind of short and sweet, but hopefully it tweaks something in your minds around how you can improve your business outcomes and how health and safety and our program can really help you as a business, because that's what we're after.
Thank you so much, Rodney. I know you're pressed for time. You do need to log out soon, but we really appreciate you actually taking us through the different calculations. And there are a few questions. If you don't have time, I think I should be able to handle most of these questions. So
yeah. Sorry, I have a meeting that they're already logged in. But Tyler, are you on still?
I am, Rod. Yes.
Perfect. Tyler's a fantastic member of our team, and he is happy to help out from here. But thank you again.
So much, Rodney. You have yourself a great afternoon. And Tyler and myself, we will be actually now taking on the questions. There are a few questions that have been posted for this particular segment with WSIB's Excellence and SOSE program. So Tyler, would you like to take a quick look at the chat and see how we can answer some of these questions? Would COR 2015 external audit count even if 100% of it has not been completed yet? I don't think for the Excellence program, they are looking for 100% completion. Tyler, you may be able to give them a little bit of a context on that.
Yeah, great question, Rose. So if I understand your question correctly, you're asking, can we use the 2015 tool? We scored less than 100%, and can we submit that to WSIB under HSEP? So what we're asking for is if a company scores less than 80% on a non-legislative element, or less than 100% on a legislative element, that you demonstrate to us that you have a continuous action plan in place. So yes, you'll still be eligible for your rebates. You just need to show us that you are that you've identified those nonconformities on the audit, and that you're taking your action plan, that you've initiated work to it. It's not required that you complete your continuous action plan. You just have to initiate action. So I hope that answers the question, Rose, but feel free to type in if that wasn't what you were looking for.
Thank you, Tyler. And there's a comment here saying, thank you so much for making it easier for companies that is pursuing COR to integrate with WSIB's Excellence to get financial rebate. This is really helpful. I know we worked continuously behind the scene to make this happen with your team. It is a great message for many of our clients, the 100+ COR ISO clients, especially the COR clients, because once they have an internal audit submitted or external audit, they can work with, so especially those of you who are our client who have joined this call, you could work with your project manager, and your project manager would be able to support you in submitting the validation to WSIB. You have to first register, go through those processes. Once that's done, Tyler, if you can kind of quickly help them understand the journey, that would be very helpful.
The journey of validation. Sorry, can you just?
Yes, from, you know, whether the internal audit report to external audit report. One of the key things all of you need to understand is, in order for you to participate in a safety excellence program, you have to be registered with WSIB approved providers. So there are about 20 providers in the list who can work with you to get the excellence program rebates for you. So FORES is one of the 20. And so you have to make sure that you are registered with Ministry WSIB approved provider in order for you to actually get the rebates that's needed. Once you are registered, especially for those who are going through the COR journey, whether COR 2015 or COR 2020, Tyler, if you can quickly help them understand how the upgraded process is going to help them.
Yeah, for sure, Sophie. Thanks for that. Thanks for clarifying. So we've made the validation process, as Rod mentioned, streamlined for COR certified members. So depending on where you are in your COR cycle, either you're year one and you're just writing the standard for the first time and having an external audit, or your cycles year 2 and 3, where you're doing your internal maintenance audit. So depending on where you are in your COR cycle, that will outline what you'll submit to WSIB through your provider, so through FORES, for our streamlined validation. So as Rod was alluding to, if you're a year one and you've done an external audit, you're going to submit the relevant section of your external audit report to us. We're not asking for copious amounts of information. We just want that relevant section of the COR audit, along with a consolidated story of how you implemented your topics. If you're in years 2 and 3 of your COR cycle, you would submit the relevant section of your internal maintenance audit, as well as your letter of good standing from IHSA to say that you are still in the COR program. For that evidence to show that you've implemented those topics. The validator, when you submit that to us, will take a look to verify the accuracy of those documents. They'll read your implementation document and your continuous action plan that I mentioned. If you need to submit evidence of that because you scored less than 80%, they'll take a look at that. They'll do a streamlined validation and mark the topics complete. And as Rod alluded to, the topics that you complete are all eligible for that financial rebate, minimum of $1,000 per topic to a maximum of $50,000 per topic. To the rebates that Rod had mentioned with those examples earlier.
Thank you so much, Tyler. So I guess that answers pretty much everybody's questions. If there's no other questions posted, I think we have pretty much made an attempt to answer most of the questions that was posted. If not, I know Richard was typing some of the answers, so the answers are in the chat box. So if you have any further questions, we'll wait for 1 or 2 minutes. If not, thank you all for joining today. Those of you who are thinking of exploring a safety excellence program as part of our option, I mean, it's just a great rebate to have, but implement the safety management system. One of the things that we have done for SMEs at FORES Consulting Services is we have created an SME support program. It is a long-term journey to implement a full safety management system. At least we could start supporting you in small chunks by at least addressing few topics at a time. At the same time, work with you to make you eligible, apply for the rebates as well while we are taking you through this journey. If you are definitely interested in any of these, please reach out to us, and somebody will be able to support you from FORES in answering your questions. Thank you so much for joining us today. And we really, really appreciate each and every one of you taking the time to join us. We will be doing more sessions. We tend to do at least 2 or 3 sessions like this to take the message across to all of our clients and people, other employers who are looking for information. So Richard, Annie, Tyler, we really appreciate the time that you have given us, and definitely your team behind the scene as well. Thank you so much, and all of you have a safe and awesome afternoon.